So good afternoon. We'll start with anti-cancer drugs. Cancer is a also known as neoplastic disease. The term is used for diseases with abnormal cells that divide without control and are able to live in other tissues. So currently, it is the fourth leading cause of mortality in the Philippines. So it is related to cyst and tumor. So compare malignant versus benign. Diba? Pag sinabing benign, it is not cancer. No? Pag malignant, yun yung cancer. And it has the capability to invade their neighboring tissues that enter blood vessels and metastasize to different sites. If it's already metastasize, it spreads from one area to another. The characteristic of a cancer cell is that it divides rapidly, it is uncontrolled, it is invasive, it is destructive, and it has the ability to metastasize, no? Through that it melts collagen and connective tissues. It is capable of intravasation and extravasation. So we have to invade vessels, no, inside the vessels and outside the vessels. And it is the capability of angiogenesis or to create new blood vessels for it to survive, yung mass mag-survive, no? Conversation niya. So, conversation. Tapos yun po, yung part, ilulus ko doon sa pagpapalagay ito. Laki na lang siya. So, yan. So, makikita nyo na it melts the collagen and connective tissues. So, angiogenesis is to create new blood vessels for the mass to survive. So, yeah. From this vessel, nag-create ng new branches of pathway para mag-supply ng blood with its new mass. So, the goal of cancer treatment is number one, for cure, to eradicate all cancer cells, and currently, the most curable cancer is testicular cancer. No? Sama mo na dyan yung thyroid cancer. Yung kilala niyo si Miles Ocampo, di ba? Diagnose siya ng thyroid cancer, no? Pero yung meron siya kanya is yung papillary thyroid cancer, no? Yung isa sa mga benign. Hindi naman din, pero isa sa mga curable na mga thyroid cancers. No? Another one is palliative, is for alleviation of symptoms. For example, ang laki na ng mass, gusto mong paliitin, we can give cancer treatments. Avoidance of life-threatening toxicity, and increased survival and improvement of quality of life. No? And other is for adjuvant therapy. It is the attempt to eradicate microscopic cancer after surgery. So after surgical removal of a mass, so we give adjuvant therapy to target this micro or something, mga cells that is not visible to the surgeon's eye. No? Kunyari may mga parang natira pa na mga ganito na hindi nakita. So, ang ginagamit na lang dyan is adjuvant chemotherapy. And there are established cancer treatments with surgery. For example, breast cancer. We remove the breast with cancer through mastectomy, matatanggalin. Another one is radiation therapy. We expose the mass through radiation, chemotherapy, hormone therapy in terms of, for example, yung mga endometrial cancer or breast cancer, may mga hormone therapy, and stem cell transplant. No? So the principle of chemotherapy is based on the cell cycle. No? It is a cell cycle, it's a sequence of events in which somatic cells duplicates its content and divides into two identical daughter cells. So, way back in biology, no, alam naman natin na ang cell, meron siyang cell cycle. So, meron tayong G0, which is the cell cycle arrest. G1, where there is a cellular contents excluding the chromosomes are duplicated. The S phase, where each of the 46 chromosomes is duplicated. G2 phase, where there's a double check. The duplicated chromosomes check for error and repairs, no? If there's need for repair, then it undergoes mitosis, then cytokinesis, or yung full separation of two daughter cells. So our chemotherapy is based on cell cycle specific or cell cycle non-specific. For cell cycle specific agents, we have phase specifically agents. Ibig sabihin nun, they are dependent or they target cells that are present in that specific stage. For example, the Vinca alkaloids targets cells currently at M phase. So asparaginase and prednisone targets G1, cells in G1 phase. S phase, no, yung antimetabolites, and G2 phase like bleomycin and etoposide. For phase non-specific agents, these agents are not particular to what phase the cell is for that cell is hindi siya particular sa isang specific phase. For example, the use of alkylating agents, anti-tumor antibiotics, and cisplatin. For cell cycle non-specific agent, they are effective in all phases, including G0, such as nitrosoureas and rejection. Irregardless, no? Regardless of which phase or ano man, no? So, anti-cancer drugs, these are the following: the plant alkaloids, the anti-cancer drugs, the hormonal agents, alkylating agents, antimetabolites, and miscellaneous drugs. So, number one, no, we have Vinca alkaloids, no? So, plant alkaloids. So, plant alkaloids, we have Vinca alkaloids, taxines, camptothecins, and podophylltoxins. Vinca alkaloid is derived from Vinca rosea. So, the Vinca alkaloids are available as IV. So, yeah, vincristine, vinblastin are the most common ones. For the mechanism is that it binds to the microtubules, forming a drug tubulin complex. And this complex terminates by formation of a promoting depolymerization and preventing of the rescue of the microtubules. So, nangyayari, di ba sa mitosis, meron dyan yung parang polymerization reaction na in preparation to the separation of in preparation for mitosis, no? So, ang nangyayari, nagkakaroon ng yung Vinca alkaloid, nagbabind sa microtubules para mag-print. Yan. So, highly unstable, no? So, ang nangyayari, magbabind siya, ang gagawin niya, sisirain niya yung microtubules, tapos ipe-prevent niya na mag-align into yung microtubules into, di ba nakatouch sa pole? Kung naalala niyo, di ba may dalawang parang mga gano'n, parang ibon ba? Yung chromosome, di ba? May nakakonect yan sa pole niyan na wag na microtubules. Yun. So, ang ginagawa niya, umaattach siya doon para mag-break yung ano. So, yung sabihin, sinisira niya para hindi mag-proceed with the mitosis. So there are vinblastine and vincristine, and the following are the side effects. So they are known for bone marrow suppression. Next is taxanes. So they are two derivative. It is derived from Western U and European U. So the agents are docetaxel and paclitaxel. So dito naman magkabaliktad naman kung si si vincristine, vincristine is it promotes depolymerization. Si taxane naman is it enhances polymerization. It blocks the dynamic instability by stabilizing the tubulin. Hence, there is no depolymerization. So, ang mangyayari naman, instead na masira, no, ang nangyayari, pinatitibay naman niya. So, ang nangyayari, hindi kumbaga, hindi na magpo-proceed kasi sobrang tibay naman nung so, nag-create siya ng stable polymer, microtubule, na ang mangyayari, hindi na siya mag-cause ng division. So they are known to, paclitaxel is known to be used in the management of ovarian cancer and advanced breast cancer, as well as docetaxel. Podophylotoxins, they are extracted from the root of mayapol. The agents are etoposide and leukocyte, and they are known to inhibit topoisomerase 2. So they are used for leukemia, testicular cancer, lung cancer. No? Camptothecins, the agents are topotecan and erythrotecan. So important lang dyan, alam niyo yung classification, no? Huwag kayo malilito. For example, topotecan, topoisomerase 1. Erythrotecan, topoisomerase 1. Pero pag sinabi na etoposide, topoisomerase 2. Okay? So, tropotecan is for metastatic ovarian cancer. Irinotecan is used for colon cancer and rectal cancer. So, for antibiotic anti-cancer agents, these are antibiotics but function as anti-cancers. So, we have anthracyclines and other agents. Anthracyclines is derived from Streptomyces pyocetus var cashews. The agents known are doxorubicin, daunorubicin, and idarubicin. This group of drugs are known to be cardiotoxic. No? And doxorubicin is also known as adriamycin. Okay, pakitandaan. No? The doxorubicin is also known as adriamycin. Okay, nilagay ko siya. Adriamycin. So the mechanism of action is that it acts by DNA intercalation that inhibits DNA and RNA synthesis, no? So baga sumasama siya with the DNA and RNA. It is a topoisomerase inhibitor also. So doxorubicin is widely used for different types of cancer, no? And however, they are known to be to cause cardiac toxicity. That's why yung mga patients natin, before starting with this type of chemotherapy, nag-require kami na 2D echo, baseline 2D echo. Kasi may risk talaga that it will impair cardiac function. And also, they are known to cause bone marrow suppression and total alopecia. Sabihin, maglalagas talaga yung bone nila. Pero tumutubo naman yun. Yun nga lang maglalagas ng siya sometime. Actinomycin is used for pediatric sarcoma or Wilms tumor. So, yan. So, something yung Wilms tumor, ano yan, something na malignancy in the colon. Parang ganyan. So, So the mechanism involves intercalation between three adjacent guanine cytosine base pairs and inhibits DNA RNA polymerases. Nicamycin, formerly mitramycin, is from isolated Streptomyces indicatus. So it is indicated for testicular cancer and other cancer that cause hypersensitivity. Mitomycin, so it is from Streptomyces staphylococcus. So it is combined with bleomycin and vincristine for squamous cell carcinoma of the cervix and a second-line agent for metastatic colon cancer. So mitomycin is an alkylating agent and also an anti-metabolite. Bleomycin is from Streptomyces verticulus, no? Which is added with vinblastine for testicular cancer. So the mechanism of action is that it causes DNA strand to break, producing free radicals, inhibiting DNA synthesis. So bleomycin is known to cause dose-dependent pulmonary fibrosis. So for anti-cancer hormones, we have hormonal therapy. For example, sa breast cancer, tina-target natin yung we give estrogen, and for prostate cancer, androgens naman tina-target. So number one, we have tamoxifen. I mean, ibig sabihin ko, is tina-target yung estrogen activity. Kasi for example, sa breast cancer, one of the possible causes of breast cancer is estrogen, no? High estrogen. So we give anti-estrogen like tamoxifen. So tamoxifen is extremely useful for the treatment of breast cancer. And for example, we give flutamide. So flutamide is an androgen, anti-androgen for the management of prostate cancer. So tamoxifen, it binds to the estrogen receptor of an estrogen-sensitive tissues, preventing estrogen molecules from binding to its receptor. So nangyari si tamoxifen, instead of yung estrogen yung mag-bind, si tamoxifen yung magbabind. So via competitive inhibition. So yan. The most common adverse effect of this is yung hot flashes. Flutamide, so ito naman is anti-androgen that it binds to the cytosol androgen receptors by competitive inhibition. So instead na yung androgen or testosterone yung magpapain is anti-androgen. So it is available as glutamine, bicalutamide, and nicalutamide. So they are in these gonadotropin releasing hormone agonists are indicated for metastatic carcinoma of the prostate and for hormone receptor positive breast cancer. So agents like leuprolide and glucerin, they are available as long-acting depot formulation. Sabihin, once a month lang yan binibigay. So the GnRH agonist, no? So ang ginagawa niya is that it stimulates the release of NSH and LH followed by the inhibition of the release of this hormone. Mamaya i-further explain ko yan pagdating natin sa endocrine topic. However, it can cause painful gynecomastia, nausea and vomiting, edema, and thromboembolism. Aromatase inhibitors such as aminoglutamide and anastrozole are indicated for breast cancer. So ito, after 5 years of taking tamoxifen, some practitioners siniship nila yung mga patients na may breast cancer to aromatase inhibitors. So, ito naman, it inhibits the adrenal steroid synthesis at the first step of conversion of cholesterol to pregnenolone. Basta ang goal nito, hindi siya mag-convert into estrogen, estradiol. So yung aromatase na yan, inhibit yan. Okay? Kasi as we all know, no, cholesterol is the parang precursor ng estrogen and ng testosterone. For alkylating agents, alkylating agents are the first anti-cancer that was developed. The prototype is the nitrogen mastard or the mechlorretamine. Overall, cyclophosphamide is the most useful alkylating agent nowadays. So these are the alkylating agents. No? So the mechanism of action of alkylating agents in general is that it involves intramolecular cyclization of the ethylene ammonium and carbonium ion. So masyado marami ito kung yung sa leader. Pero ang basta important that alkylating agents does not, it is ano ba yan? Non-cell specific. No? So it targets lahat ng phases. So these are the indications for some cancer conditions, no? Like mechlorretamine is indicated for Hodgkin's lymphoma. Carmustine is for CNS tumors, melanoma, and lymphoma. Cisplatin is used for testicular, ovarian, and bladder cancer. Carboplatin is for ovarian, and cyclophosphamide is for breast, testicular, and solvents. Ito, in general lang to, no? Pero hindi ko yun, huwag nyo na lang i-memorize. So, ang naalala ko may table ako yata dyan sa handout, no, sa dulo. Yun siguro mas useful yan kasi yun yung combination na ginagamit talaga sa mga iba-ibang cancers, no? So, yeah. Antimetabolites, ang important lang dito sa anti-cancer, alam niyo yung classification. For example, antimetabolite, ano yung antimetabolite na? Cancer, pang-cancer. So, pag sinabi ng metabolite, antimetabolite, di ba yung sa column, yan, di ba? So, ang available for anti-cancer is, yun nga, sa methotrexate, no? Eh, di ba sino ba yun? Si Pisaclino, nakano siya ngayon? Alam ko parang naka-methotrexate yata siya ngayon. Parang sinabi yata, parang naka-methotrexate siya ngayon. Di ba parang dinayag siya ng maraming sakit. Tapos, ngayon naka-methotrexate siya. Tablet lang yan. So, methotrexate inhibits dihydrofolate receptor. It is used for acute leukemias, breast cancer, and soft tissue sarcomas. So methotrexate is also used for rheumatoid arthritis, psoriasis, and other autoimmune diseases. Pero yun naman, ang sinabi naman kay Chris Aquino, di ba? Hindi naman siya cancer. Pero meron siyang autoimmune disease. So other anti-metabolites, we have purine antagonist. So mercaptopurine, it is a first-type purine found useful as an anti-cancer drug. It is indicated for childhood acute leukemia. And the most common side effect is the bone marrow suppression. Thiaguanine is an anti-metabolite with synergistic effect to cytarabine for acute leukemia. Ano nakakawa kung mga patients sa may leukemia talaga? Kasi parang wala na talaga sila. Kasi dugo na yun eh, no? Tapos abnormal yung dugo. Wala na nakakalungkot ka. So, fludarabine is indicated for lymphoproliferative diseases, and the mechanism of action is that it must be converted to thyroxine 4 to inhibit RNA and nucleic polymerase. The most common adverse effect is myelosuppression. So, ito cladribine, no? This is an important question. It is indicated for hairy cell leukemia. The adverse effect is severe bone marrow suppression. So, marami pa tayong antimetabolites like 5-fluorouracil. This is a fluorinated uracil, no? Available as IV and topical, widely used for colorectal cancer. Cytarabine, so it is indicated as a major drug for AML, or acute myelogenous leukemia. Azacitidine is a second-line treatment for acute leukemia. So, majority of anti-metabolites are used for leukemias, mapapansin. So, for the miscellaneous anti-cancers, we have asparaginase, no? Asparaginase is derived from asparagine, yung ano na, ano ngayon yung yung asparagine din naman na amino acid. So, it is an enzyme isolated from virus bacteria for clinical use. It is indicated for childhood acute leukemia. Hydroxyurea, it is used for leukemia and melanoma. Actually, ang mahal nga nito ay it is available as tablet form. So, it can cause bone marrow suppression and GLC. Nitosanto, it is indicated for pediatric and adult care myelogenous leukemia. And mitoting, so this causes tumor regression during excessive adrenal steroid secretion, and often occurs during cancer. And retinoic acid derivatives, so mga isotretinoin and all trans-retinoic acid, no? They're also used as treatment for cancer. Yung mga bone marrow growth factors like GCSF and GM-CSF is that they're used for cancer, not because they are treatment for cancer, but they are reduce the frequency of leukemia and other complications. Kasi kung mapapansin nyo, lahat ng treatment for cancer, may bone marrow suppression, ganyan. So bumababa, nagkakaroon ng leukemia, bumababa ang neutrophils, bumababa ang WBC, bumababa ang platelet. So ito yung add-on natin, supplement natin sa mga patients na bumababa yung WBC, bumababa ang platelet, no? That is yung mga bone marrow growth factors. Amifostine, this is metabolized to its active form by alkaline phosphatase at normal sites. So, our mechanism of action is it produces cytoprotection of normal tissues from cytotoxic effects of anti-cancer drugs. So, sometimes it is an add-on to protect, kasi diba sabi nga natin, may mga drugs tayo that targets, that do not target, that is not specific, no? So, kaya nga diba sabi, lahat affected, pati normal cells. sa anti-cancer. And amifostine is one drug that we incorporate in some chemo formulation regimens para ma-protect yung mga normal tissues from damage. So there are biologic response modifiers also that we can use to protect normal tissues from damaging. So yeah. So it alters or enhance the patient's immune system to fight cancer or to lessen the side effect of cancer treatment. So yan, no? Hindi ko na yan masyadong i-ano. Basta may mga ganon. So ito, important na alam nyo, si Chemo Man. Alam ko na sabi ko na to sa inyo before, pero as a recall na lang, no? Para lang, ito yung mga most common adverse effects sa side effects ng cancer treatment. So yung C, di ba yung tenga, no? Is quercetin and carboplatin. They cause nephrotoxicity and acoustic nerve damage. Sabihin nakakabigin, no? Acoustic and nephrotoxicity, parang okay? Dapat alam niyo siya ito. Then ito, kasi vincristine can cause peripheral neuropathy. D for doxorubicin, kasi nga cardiotoxic. P for bleomycin, basta baga. Pagka-pulmonary baga. Pulmonary yan. Pulmonary fibrosis. Okay? Huwag nakakalimutan. Baga. P for baga. Bleomycin. Pulmonary fibrosis. Ito naman, para siyang urinary bladder, no? Kasi cyclophosphamide can cause hemorrhagic cystitis. Hemorrhagic cystitis. Nasa handout niya, hindi ba kita? Okay. Tapos ito 5-6, may ganyan. Kaya siya 5-6. M for methotrexate, 5 for 5-FU, and 6 for 6 mercaptopurine. It can cause myelosuppression. Kaya siya 5-6 and myelosuppression, no? And D4, which is peripheral neuropathy. Okay? So, yun yung mga important siguro na dapat namin. Next, we have gastrointestinal drugs. So, we have to define first constipation. So, pag sinabing constipation, it is the difficulty or infrequent passage of stool. Pero yan, may quantifier pa yan, no? So, it is described having fewer than 3 bowel movements per week. No? Ibig sabihin, well, depende kung yun na yung normal nyo, pero yun nga, hindi naman lahat ng tao, minsan nga daw, hindi ko kasi iba sa pero meron nga daw once a week lang dumudumi. Pero hindi kasi normal yun. No? So, ang definition of constipation is that fewer than 3 bowels per week. No? And there are different medications that can cause constipation. No? We have narcotics, antacid, iron and calcium supplements, anticholinergics, and diuretics. So we give them laxatives, also known as purgatives, also known as cathartics. These are agents that can promote an ease defecation. And naalala ko lang bigla si Alex Gonzaga sa The Entitled ba yun? Hindi nyo napanood kasi panoorin yung yung lagi kasi siya natatake doon, parang sabi, pag nag-i-English ka, sumasakit yung chan niya, tapos parang siya natatake. Pero ito, constipated, napaaga. So, yeah. So, there are different treatments that we can use for constipated patients. So ito, sa pharmacy practice nyo, pag sa community, pwede nyo ito magamit. Usually kasi, majority of them are non-prescription, no? Kasi, ay, paano tatay ako, bibili agad ng Loperamide, or ano pwede nyo ibigay, pag tatay, doon. Pwede nyo siyang ibigay. So, number one, we have bulk-forming laxatives. So, dito, polysaccharide derivatives that act in both small and large intestine, they absorb water forming a bulky gel that distends the colon and increase peristalsis. Kasi, gagalaw lang ang colon niyo pag na-detect niya puno yan. No? So, pag puno yan, kasi kaya naman, yung iba naman, kaya pala once a week, kasi continue talaga siya kumain per meal, no? And bago mapuno yung tiyan niya, no, umaabot ng 1 week siguro, kaya nadidetect din tiyan niya na gumalaw after a week pa. So dito, ang ginagawa niya, para siyang, alam niyo yung, sino na nakapag-seal yung fiber dito? Para kasi siyang ipa-ipa, di ba? Tapos, nagpakakalasa niya, no? So, para siyang ipa-ipa. Tapos, pag na-mix siya with water, nag-expand kasi siya. Para siya nagiging oatmeal, basta parang lumulobo siya. And in the colon, mas lalo siyang nag-distend. Parang pakiramdam mo din, puno na rin yung tiyan mo. So, ang mangyayari nun, i-eat niya yun para maggalaw yung tiyan mo. So the onset of action is low and it is used to prevent constipation. Kaya nga, di ba, pag puro fiber yung kinakain mo, mas mabilis kang madumi. Kasi mas mabilis mapuno yung tiyan mo, nag-expand siya in the colon. So there are natural bulk-forming laxatives. Number one is psyllium. No? So yung psyllium fiber na nabibili at the market. So it is from Plantago ovata. So usually, ano yun eh, meron naman yun yung nasa oral capsules na, para hindi nyo na, pero kasi may iba, preferred yung lasa ng ipa, parang ipa. So yan yun, no? Capsule form or yung mga, para siyang fiber. So yun is malt soup extract, no? Pero huwag yung masyadong kabisado yung mga doses. Lalo sa board exam. So, methylcellulose and polycarbonate are synthetic bulk-forming laxatives. So, number two, we have osmotically active agents, also known as saline laxative. It acts by creating an osmotic agent to pull water into the small and large intestine to stimulate peristalsis. So it also increases the activity of cholecystokinin pancreocyanine enzyme that increases the secretion of fluid in the GI tract. So ang tendency nito is to pull water, no? Para mapuno yung tiyan mo ng water, itutulak ng water yung contents ng tiyan mo. So there are different types. Now we have non-absorbable salts like magnesium citrate, magnesium hydroxide, and magnesium sulfate. Also with sodium phosphate, no? Phosphate available as liquid phosphosolia. So there are also non-absorbable sugars, no? That for example, glycerin. It can be rectal burning, no? Para ma-stimulate yung release ng fecal matters, lactulose, and also sorbitol. So, also non-absorbable alcohol like polyethylene glycol solutions. Next, we have stimulant laxatives. So the mechanism of action is that it stimulates the intestinal motility by direct stimulation of the enteric nervous system and colonic electrolyte and fluid secretion. So ito yung mga pinaka-uso, no? Pinakasikat, si Vigor-Lite para sa tiyan na sex. Alala niyo ba yun? Wala ko mag-gets nyo. Sobrang tanda ko na ba? Ito, commercial ni Tony Gonzaga before. Para sa China Sexy, mag-deliver lang. So, yan. So, at Trakinong, it's available as Sena, Cascara Sagrada, and Aloe. They are fully absorbed in the GIP, and its long-term use can cause melanosis coli. Alam ko na sa exam nito before, parang nilagay yun, side effect, melanosis coli. So, ang sagot dyan, ang Trakinong. Tumama naman kayo doon. Oh, tatandaan nyo na lagi yan. Pero dahil naligay sa example. Oh. Second, we have diphenyl methane derivatives. So, kasama naman doon si bisacodyl. No? So, it is available as tablet or suppository. No? Pwede rin castor oil. Si castor oil naman, ang nangyayari, it is hydrolyzed in the upper part of the small intestine into ricinoleonic acid that stimulates intestinal motility. So, it cannot be used as implementation, pero ginagamit ito for bowel preparation, for colonoscopy, no? Ginagamit, castor oil. Emollient laxatives. So, ito naman, they are known as stool softeners. So, it acts as surfactants by allowing absorption of water in the stool. Okay? Useful in patients to avoid straining to pass hard stool. So, usually, pag mga post-surgery sa puwet or sa colon, ito yung binibigay. Para malambot lang yung dumi nila. So, we give docosate, sodium, docosate calcium or potassium. Lubricant laxative. So, it works at the colon. It penetrates and softens the stool and retards water absorption from the stool. An example of lubricant laxative is mineral oil. The Gaserol is also, no, nabanggit na sa atin before, 5-HT4 partial agonist. No? It is a serotonin derivative. It is used for stimulation of the submucosal plexus. Pero currently due to adverse effect, we withdraw na sa market. So for pediatric patients, for acute relief, we give glycerin suppositories and magnesium sulfate. So kung naalala nyo, nung bata pa kayo, tayo, no? Suppository yung mas binibigay sa mga patients, no? Sa mga pediatric patients. Pero ang last resort is the stimulant laxative. Hindi, as much as possible, hindi pinapainom ng mga seta ang bata. No? So, enema, it is used for the evacuation of bowel before surgery. And usually given for treatment of acute constipation responded to other medications. So yan siya, no? Yung butas na yan, ay yung tusok na yun, ipapasok sa butas. Tapos after some time, lalabas na yung dumi. Sino naman nagamitan ng ganito? Siyempre walang aamin sa inyo. Lalo ba kayo inamin sa akin? Thank you for the help. And then, pero kasi, I have this patient talaga, nung clerk ako, syempre lahat ng photos gagawin talaga, kahit mga dirty works papagawa sa loob. So sabi ng president ko, sige, i-enema mo na. So yung patient, hindi pinapresto ko na, hindi kasi talaga siya madumi. No? As in talagang as in talagang napatalog talaga ako kasi talagang lumabas talaga yung group talaga. As in talagang pagalingan ng ilag talaga sa mga ganitong patient talaga. Kasi pagka buti na lang hindi siya yung sumirit, gano'n. Gusto po talaga. Ay, oh my God. Pag naaalala ko, gusto po. Para siyang ang gagawin, may mga ano kasi yan position, no? There are two positions using this schema. Pwede siya yung left side position or knee chest position. Siyempre, hindi naman ito yung ginamit ko. So, ito naman. Hindi ko kaya kaya. May naalala ko sa ako dito patient natin. Physical exam. Dati after ko kasi ko sa parang racket ako as parang physical exam, parang examiner. Sabi niya, kasi pag mga ganyan, tatanungin kayo kung gusto niyo pa rin ipa-examine yung rectal. Pero dapat, ikaw yung patient mismo mag-decline. Sabi, sige po, gusto ko po ipa-check po talaga. Nag-prepare pa lang ako, nag-gloves na lang ako. Pagtingin ko sabi ko, shit. Sir, hindi mo ganyan. Check ganito lang. Sabi ko, nakaganto na siya. As talagang nakaganto siya. Ready na talaga siyang masundot talaga. Well, yun yung mga dirty works talaga ng our profession. So, yeah. Pero it's your, syempre, yan, bibilin sa inyo yan. And your responsibility is to teach them the proper way of administering yung Enigma. So, yun. So, nasa sa inyo na yun. Kung meron kayong toy doll na pwede yung or kayo nang bahala. Sa pharma counseling yun, di ba? So, enigmas are hardly experienced in children under 5 years of age. So, for geriatric patients, hindi natin ginagamitan ng stimulant laxatives, no, on long-term use. So, pwede natin gamitin iba-iba, like yung mga malforming, mga lubricant, mga ganun lang, no? But stimulant must be restricted. Especially on pregnant population, no? We advise them to use bulk-forming agents or school softeners as much as possible. Pero hindi pwede yung yung mga stimulant kasi baka mamaya manganak yan bigla, no? Kasi pag manganak yung mga kung sino man nanganak na dito, meron na ba? Ayun. Para siyang matatay na hindi mo maintindihan, tama ba? Ay, nakabuti na meron na. Meron na. So, para siya matatay, may mga patients kami na sasabihin na, wait lang po, madudumi lang po ako. Ay, mahulog ka na naman. Tapos didiretso sila sa CR, ang ending. Pipilit talaga nila, mamalik mata ka lang, nasa CR na sila. Tapos yun, paglabas nila, nakalabas na yung ulo ng baby. Talaga ang sarap bagukan talaga. Kasi pag gano'n, ano na yun ang hindi kasi naiintindihan ng mga lalo na yung itinatago sa media yun yung mga nanganganak sa tricycle. Kasi nga, dirty yun. Pag nanganak ka doon, may tendency na yung patient, yung baby, pwedeng may infection. Kaya hindi yun talaga iba proud na proud pa nanganak sa tricycle, ganun. So, hindi yun talaga, as much as possible, kung kaya mong harangan, huwag kang manganak sa kalsada. Yung mga, for example, nurse, pinaanak sa kalsada yung nag-aano ng anak. Ewan ko ba parang sinensationalize yan? Kung nabalitaan niyo ba yun, yung sa may LRT pa yata nagpaanak? It is something na dapat hindi proud kung sino man ang nun. Oh, okay, tinulungan niya. Pero kasi, as much as possible, dapat hindi siya doon manganganak. Kasi pwedeng mamatay to other infection ng baby. And also, yung iba, minsan nakaka-cause siya ng psychiatric problem, no? Kasi yung chronic use of laxatives, inom sila ng for weight loss and bulimia, yun pala, meron na silang poor self-image. Parang ba to? Yung sa PBB last Alexa. Di ba, meron siyang poor image, parang, hindi naman siya mataba talaga eh. More sa TV mo siya mataba, pero sa actually siya mataba. Napanood ko parang meron siyang something psychiatric, di ba? Na ang tingin sa sarili niya, ang taba-taba niya. Pero sa totoo nun, hindi. Kaya siya papayag siya ng papayag. So, ito yan, no? Magkakaroon ng poor self-image. No? Napanood niyo na ba yun? Yung walang aray, walang sugat. Basta if you have a chance na maganda yun. Si Alexa Ilacad sa Pilipinas. Nanood kami last February. No? Alam ko hanggang up to this day, pero yun nga lang sa Manila nga lang. So next, we have anti-diarrheal drugs. So kanina, parang tinitipin, ngayon naman, nagda-diarrhea naman tayo. So diarrhea is the abnormal increase in frequency or looseness of the stools. And there are two types of diarrhea. We have acute diarrhea. Ibig sabihin yung diarrhea that exists less than 2 weeks. It can be due to infection, diet-induced, or drug-induced. So we have also chronic diarrhea, more than 2 weeks na siyang nagtatae. It can be due to protozoa, food-induced, and other symptoms like IBS or malabsorption syndrome. And the non-pharmacologic treatment that we can give to those who are experiencing diarrhea is to check for their diet. No? So children should remain on their normal diet or breastfeeding during diarrhea because they do not make diarrhea worse but actually improve their diarrhea. Yung for example, breastfeeding yung mom, tapos tatanungin kayo sa butika, ano mo pwedeng bigay? Sabi niyo, breastfeeding nyo lang, tuloy nyo lang po yun. No? Or make sure na yung pag maligo yung nanay, tapos yung breast lagi malinis before letting the baby suck their nipples. Or, yun nga, change yung tubig. Di ba? Possible niyan, baka mamaya, nagtatae dahil sa water. Hindi mga ganun na mga bata ngayon sobrang sensitive. Dati sa poso lang kumukuha na tubig. Ngayon naka-Wilkins na absolute na yung baby, di ba? Kahit panligo. No? So, and also we recommend yung ORS. So ORS pa for hydration kasi ang problem sa diarrhea, nagkakaroon ng electrolyte imbalance due to dehydration. No? Pero pag yung patient severe na, ipa-hospital na, advice nyo na pa-hospital. No? Hindi nyo na kaya yun. So this is sample lang ko ng component ng ORS, no? Hindi naman mga nice to know lang yan. So for example, Gatorade, daily 1:1 kasi sobrang tamis no ng Gatorade that it can further aggravate diarrhea. Bawal din yung mga hypertonic fruit juices and drinks, carbonated beverages kasi it makes the diarrhea more worse. So, binibigay natin pag mga drugs, we have antiperistaltic drugs, absorbents, mucilaginous agents. So, for opioid antagonists, it is used to decrease hypermobility of the plexuses and decrease frequency of power movements. So, diatops, Imodium, yan ang pinakasikat. It can be used alone or in combination with trimethoprim against traveler's diarrhea or an adjunct for chronic diarrhea. It does not cross the blood-brain barrier but has a potential for addiction. No? So ang dosing niyan, kasi 2 mg ang isang, di ba, available siya 2 mg. So initially 4 mg, then every unformed stool, 2 mg ng 2 mg until ma-reach ng 16 mg per day. Okay? So, i-advise din natin yung yun nga, pag diarrhea, hindi laging loperamide, no? Pag yung emergency lang yan. So, Lomotil ngayon ay parang loperamide na rin ata ang laman. Pero previously, it is diphenhexylate and atropine, no, before. It is a prescription drug kasi due to the atropine and diphenhexylate. On prolonged use, it can cause opioid dependence. Kaya hindi na yun masyadong, nireformulate na ng Lomotil yung kanila anti-diarrheal drug. Adsorbents, so it is used for symptomatic relief. It absorbs toxin, bacteria, gases, and fluids, therefore decreasing the stool liquidity. So an example is activated attapulgite and calcium carboxylate. Miscellaneous agents include bismuth subsalicylate, lactobacillus, lactase, anti-infectives, and cholinergics. Bismuth subsalicylate is it works as an adsorbent, no? And pakiklik no, the adverse effect of bismuth is grayish black stool or tongue and ringing of ears. So yun yung characteristic side effect ng bismuth when taken. Lactobacillus naman, so familiar kayo sa mga Yersinia flora, di ba? So they are used to replace the normal bacterial flora that is lost during administration of antibiotics and during diarrhea. Lactase, ito naman binibigay sa mga lactose intolerant, no? To digest like lactose into glucose and galactose. Sino ba mga lactose intolerant dito? Meron ba? Hindi pwede na. Majority of Filipinos are lactose intolerant. No? Hindi sila, pag uminom ng gatas ng tatay talaga, no? And for those na talagang sobrang malas talaga na lactose intolerant, ayun, pwede silang mag-take ng lactase for them to digest lactose. Anti-infectives, so usually pag yung mga travelers diarrhea, pwede tayo magbigay ng antibiotics for them, no? Especially as prevention. For example, sa isang area na talagang liblib, for example, punta kang Cambodia or something na liblib talaga na walang safe water, we can give patients or with anti-infectives for diarrhea, such as ito, should be given started 1 day before arrival with IV incidents and continue until 2 days after departure. So, mangyayari na iniinom niya yun, well, nandun siya, tapos 2 days after, tsaka nilang iinom. So, these are the drugs that we can give, no? Fluoxetine, doxycycline, or fluoxetine, so, pero syempre, bago mo, hindi na natin bibigyan, pero yun nga, based yan sa US CDC. Kasi syempre, as third world countries lang, for example, India, di ba nakita niyo naman yung India, no ba, yung kung saan sila dumudumi, di ba, parang, yung CR nila, parang ganun lang, tapos parang basta, di ba, wala silang halos CR talaga doon. So, yun. Kanya, pupunta lang kayo sa, mamimili kayo, in a way, napunta kayo sa maduming area ng, ng India. Yun. Okay. Kasama ka tayo dito, discriminate talaga tayo. Diba? These are risk areas for traveling to India. Ayan, no? Kasama tayo. Talaga namang mga foreigner na yan, no? Kasama tayo sa sila ng green. So, sa kanila, wala ng travelers na yun. At pag nakita mo, no? Yan, no? Mga nag-roll countries. Halos na to, buong Africa na, no? Anticholinergics, yan nga, because they can decrease bowel motility. So, example niyan is atropine and hyoscyamine. So, yung mga familiar kayo sa mga bustupan, yan, para hindi masyadong gumalaw yung colon nyo, no? Pwede na natin bigay. Bile acid resins. So it decreases diarrhea by caused by excess fecal bile acids. And for some patients, no, yung mga patient post-operation, no, we give octreotide for the treatment of dumping syndrome. So yung dumping syndrome, ang nangyayari kasi dyan is that nagkakaroon ng rapid gastric emptying, no, after an operation. So ang nangyayari tayo sa nagkakaroon. No? So next, the GERD, no? So, yung GERD, also known as heartburn. So, yung GERD is a reflux of the gastric contents resulting to esophageal tissue damage or symptoms of heartburn when the acidic contents stay in prolonged contact with the esophagus. So, ito, as much as possible, di ba sabi ko kahapon na, dapat ito, close yan. No? Pero, dahil nga weak yung muscle that controls the strength of that sphincter, nabubuksan yan, kaya umaangat. Nai-irritate, kasi ito, ang stomach natin, makapalang lining yan. And it is resistant to the acid that it is producing. Pero pag napunta kasi sa lining ng esophagus, iba ang lining yan, kaya nasusunod. Sorry. Nasusunod yan, parang na-irritate. That's why nararamdaman natin yung sensation of, ano ba yan? Nararamdaman niya yung sensation of heartburn. Isa nararamdaman niya yan, nasa tip na dito, no? Sa chan nyo din. Sometimes, as the acid goes up, nararamdaman niyo na parang nag-chest pain kayo or sometimes nagkakaroon kayo ng difficulty of breathing. And ang pinaka-worst, para kayong sinasakal. Okay? So GERD is a burning sensation or pain located in the lower chest that can radiate to the chest, no? And usually can be identified as MI. Pero kasi sa elderly, no, if the patient is complaining of chest pain, no, pwedeng, hindi kasi primary sa bata, sa mga edad natin, no? Sama na ako, so edad natin, GERD ang consideration. Pero pag yung edad na siguro nasa 50s and above, no, we can consider others like MI. Kasi pwedeng yun ang presentation. May mga patient ako, wala sa chest pain, masakit ang tiyan, pero pag ECG, atake sa puso pala, MI pala siya. So, symptoms na usually occur after meals or lying down on bedtime. Kaya hindi advised na after kumain, may hihiga ka na agad, no? And pain on swallowing may suggest severe mucosal damage. So, the important protective force is the lower esophageal sphincter. Lower esophageal sphincter. So, yan yung nag-control kasi and usually there's one video that I saw, there's a real si Maritoni Fernandez. Kiniklaim niya kasi na yung barley nakakapagpa-strengthen ng hindi ko alam kung ako lang, kilala niyo ba siya? Baka hindi niyo kilala. Si Mami for sure kilala ko Maritoni Fernandez. Artista, di ba? Breast cancer survivor. O baka hindi niyo ha? Basta may interview siya na parang about barley and all, that yung barley daw can treat GERD and all diseases. Sobrang talagang task kilay ko talaga. So, walang studies that can, yun nga, ang ano lang dyan is talagang diet and all, wala nakakapagpatibay dyan unless surgical talagang hihigpitan niya, no? And there are many drugs that can reduce the LDS tone, such as the following. So, yan. Pero, yan. Kung nag-take ka niya, possible, pwede ka rin may GERD, no? And, the non-pharmacologic treatment that we can do is to elevate the health. is to elevate the head, no, about 6 inches. Basta naka-elevate yung head nyo. Eat evening meals at least 3 hours before going to bed. Avoid lying down after meals and avoid floating that fits tightly around the abdomen. So for that, pwede nyo prevent yung attacks. Kasi usually yan, nag-a-attack yan sa gabi. Sino mga nag-journey dito? Diba? Minsan talaga parang bigla na ako nagising 3 AM talaga. So, yung papunta ko dito, sabi ko, parang yun yung ginawa yata ng alarm clock, kaya hindi na ako nakatulog. Kaya kahapon antok ako kasi nagising ako dahil nag-journey ako. So, nag-gabis ako. Okay, yun. Well, kasalanan ko rin naman kasi overheating. Sorry. So, there are foods that can relax and weaken everything such as chocolate, notorious coffee, but I can't live without coffee, sorry. Pero, yun nga, ina-advise natin yung mga patients natin, no? Coffee, fried and fatty foods, tomatoes, alcohol, large meals, and citrus foods. Fruits, they can cause talaga yung can trigger. Isama nyo na din dyan yung spicy food. Ayan. But, ito, no? So there are different pharmacological treatment that we can give to patients, such as antacids, no? So antacids, it neutralizes the gastric acid, no? To relieve the heartburn. So sodium bicarb, calcium bicarb, aluminum hydroxide, magnesium hydroxide, or the combination magnesium aluminum. So it interferes the absorption of different drugs such as the cyclic, immunones. Yan, so hindi yan pwede sabay dyan. Sodium bicarbonate is for the short-term relief of symptoms. The only antacid available and thus alter systemic pH, no? So, kasi binibigay din yan for patients na may metabolic acidosis. Calcium carbonate, useful for journey but can cause constipation and a very good source of elemental calcium. Aluminum hydroxide, it causes constipation and can be avoided for patients with already pre-existing constipation. Magnesium naman, it causes diarrhea. Di ba, familiar kayo sa alatae at saka magtatae. Ayan, para madali nyo maalala. Magnesium, that's why, para maging beneficial, no, yung effect ng magnesium and aluminum, kinumbine siya. Di ba yung ano ba yung, hindi siya maalox, milong yata yun pagka tamang pronunciation, I don't know. Pero yun nga, hindi siya maalox. Kasi sa atin, maalox, no? So, it is a combination of magnesium and aluminum, no? That is used as antacid. Nung bata ko, ito yung iniinom ko eh. Maalox, no? Second is alginic acid. So, ito yung mga gamis ko. No? It works by reacting with sodium bicarbonate and saliva to form viscous solution of sodium alginate. And when reflux occurs, this sodium alginate rather than the acid is reflux, thus the irritation is minimized. And yun nga, di ba, ang sodium alginate adds a protective layer, no, to the stomach. Kaya mababawasan yung irritation in the esophagus. Third, we have H2 blockers. So yan yung mga drugs na yan that blocks the H2 receptors. Previously, they are the drug of choice, no? For mga GERD, ganyan. Pero ngayon kasi, PPIs din yung drug of choice. So si metidine, it is the prototype H2 blocker. However, it has many adverse effect and drug interaction. Kaya hindi na namin nowadays. Famotidine, the same with cimetidine. So ranitidine, nung bata ko, ito yung binibigay ng ranitidine. And nisatidine. And important to note that nisatidine, it it is the one that does not impair hepatic metabolism of other drugs. Okay? So sa kanilang apat siya lang yun. Sa prokinetic drugs, so it stimulates esophageal motility and CSAP for sedation, depression, and extrapyramidal symptoms which limit the usefulness of the drug. Cisapride, it is an analog of uh, serotonin 5-HT4 receptor antagonist for the relief of GERD. Pero currently, hindi na ito ginagamit. And the mostly used drug is protein pump inhibitors that suppress the acid suppression. So the most common dyan is yung omeprazole, marketed as Prilosec. So ang mga ano dyan, usually pantoprazole, ito yung drug na binibigay for yung talagang for drugs, kunyari marami siyang talaga mo to prevent drug-drug interaction, pantoprazole yung binibigay. Esomeprazole, para nasa exam nyo tayo yata to before, no, that it is the S isomer of esomeprazole, and ito yung next show. Sobrang mahal ito. Nung nag-lapse ang omeprazole, parang yung kanilang ano ba yung patent, they launched the esomeprazole and they market it as more effective than omeprazole, but it's not. No? It is also the same. So for pediatric patients, we advise antacids with or without alginic acid. No? H2 blockers not approved to patients younger than 12 years of age. Pag geriatric patients naman, antacids and H2 blockers, pwede yan sa elderly patients. Pati PTIs din naman. So for pregnant patients, kasi usually nagjo-join ang mga pregnant dahil naiipit ang stomach. No? So antacids are relatively safe, but the others are not. Okay? So, ano na lang is endocrine? Bukas. For being na, pagkaya natin ihabol ngayon, edi we'll start. Para bukas. Baga tayo makawal. For endocrine drugs, so we start with steroid hormones. So, ito, pakitandaan lang din, no? Baka lang, no? Kasi, steroids, hormones are derived from cyclopentano per hydrophenol or CPP. So, ito yun, no? Cyclopentano per hydrophenol. So, this is the basis for the structure of the sex steroids and corticosteroids. So we give this sex steroids. So estrogens, they are tawag dito, it can be steroidal, natural or synthetic, or non-steroidal. And the precursors are testosterone and androstenedione. And there are different source of steroidal estrogen. We have natural, no? So E1, E2, and E3. And they are derived from different sources. So for example, estrone, they are abundant during menopause. Estradiol are the major secretory product of the ovary, and E3 or estriol is from the fetal-placental unit. Okay. So makikita nyo that the precursor is cholesterol to make progesterone. Then further conversion will lead to the formation of testosterone. And by the present aromatase, we form the estradiol. At the adipose, no, we form estro, and when reduction to this enzyme, it will form estriol, di ba? Kaya siguro di ba sabi nga nila yung basis ng pagiging lalaki o babae nga, isa lang naman yung kasi lahat tayo testosterone din. Kung maging babae ka, hindi niya mag-perform ka ng pathway to make estrogen. No? So, synthetic estrogen are the following. So we have also non-steroidal estrogen. So the most popular is the diethylstilbestrol. So we have progestins naman. Yung progestins, ito yung mga we have progesterone, which is the natural one, and the synthetic one. So ito yung ginagamit natin for mga pills, no? Dito na lang tayo sa clinical application. So the clinical application of estrogen and progestin is that it is used for fertility control, hormonal therapy, ovulation induction, breast cancer, endometriosis, and abortion. So number one, fertility control, it is commonly used for estrogen and progestin to suppress gonadotropin release, to decrease the follicular stimulating hormone and luteinizing hormone. Therefore, no ovulation. Okay? So, sino mga nakapag-pills na dito? Nagpipills. So, relatively, ang ginagawa nun is that kinokontrol niya yung cycle mo for you not to ovulate. No? But it doesn't guarantee na hindi ka na mabubuntis. No? It is, tawag dito, hindi siya 100%. So, there are different types of yung mga pills. We have monophasic. So, it has a constant dosage of the components. So, sabihin, di ba, pag nakakita na kayo ng panig ng na pills, di ba para siyang 30 days na parang per month, no? So, pag monophasic, ibig sabihin, lahat ng tableta yun, parang-parehas laman. Pag biphasic, kalahati, mababa yung progesterone estrogen ratio. Sa kalahati naman, higher ang progestin estrogen ratio. Kaya important pag kunyari may patient kayo o may client kayo, bumili sa butikan nyo, emphasize nyo na hindi pwedeng mag-miss ng inom ng pills. Kasi baka mamaya, mababago kasi iba yung mga kada araw yung mga ibang lahat yan. So mangyayari, hindi niya kung nag-miss siya ng dapat iinumin niya at the same time. Kunyari, uminom ka ng 12, yung first tablet mo, yung masusunod na tablet mo, every 12, yung inom mo nun. Hindi pwedeng mababago. Okay? So, kaya pag minsan, nabuntis kasi ako pero pag tingnan mo naman yung yung mga tableta, merong isang meron pang laman. So, kaya pala. And yun nga, triphasic forms. So the dosage of one of the components is increased every 7 days. So yun lang yung difference niya. And the beneficial effects of contraceptives is it is protective to the following cancers, no? And decreased menstrual blood flow, preventing anemia. So yung mga patients na ang lakas-lakas magregla, mga ganun, or irregular ang menses, pinapainom niya ng pills. And there are absolute or relative indications for prescribing pills, no? Pero hindi for you, it's not for you to remember. Next is fertility, ayan. Progestin, we have progestin-only contraception. So it is suited for patients whom estrogen therapy is undesirable. Kasi yung estrogen, pag isa nakakapag-cause nga siya ng hot flashes, or may patients na hindi meron silang sensitivity to estrogen therapy. That's why progestin lang yung binibigay. So we have ED pill, like norethindrone and norgestrel, and injectable contraceptives. So every 3 months yan, nagpapa-inject sila, no? Kasi yung iba, ayaw nila ng IUD. Familiar kayo sa IUD? Yung inilalagay sa loob para harangan yung yung sperm. During may tali yun, may nakalapit na tali dun sa puwerta ng patient. No? Ito, yung implant. Familiar kayo sa implant? Sino may implant dito? Wala. So yun yung parang ini-inject niya na yung yung implant, siya, beneath the skin yun. Tapos, ang component nun is levonorgestrel. No? Levonorgestrel. So, ang nangyayari, may depo reaction siya. Ang gagawin is, slowly release siya for 5 years. After 5 years, papatanggal din. Then, kung gusto niyo pa ulit, pwede kayo magpa-implant. Sa ilalim, yun, ng balat. Para siyang familiar pa kayo doon sa Watusi. Parang ganun lang siya kalaki. Kasi ilalagay siya dito. So yung mga patient, meron sila dito na parang Watusi, ilalim ng balat din. Post-coital contraception. So, yan. Hindi naman yung tatanong sa inyo, huwag na lang ito. For menopause, we give hormonal therapy. Since hormonal therapy can cause, kasi as yung mga babae nag-age, yung estrogen bumababa, di ba? After menopause. And it can affect yung calcium scores ng mga babae, no? That's why prone sa osteoporosis, sa bone loss, no? At saka sa bone fracture ang mga babae pag less ang calcium scores. It can also be used for patients with ovarian failure, no? Dysfunctional uterine bleeding, luteal efficiency, no? So, yan. Next is ovulation induction. So, ito yung mga patients na hindi magkaanak, no? And bibigyan natin sila ng clomiphene citrate, no? To stimulate production of LH and FSH. Next, we have human menopausal gonadotropin. It is isolated from the urine of postmenopausal women, no? That will increase the FSH and LH to promote fertility. Ito naman, meron kasi mga patients na hindi mag-ovulate due to hyperprolactinemia. So, mataas ang prolactin levels. So, we give dopamine agonists like bromocriptine to decrease circulating prolactin. However, it is useful also for women with amenorrhea and anovulation. No? I remember this patient, no, na meron, gusto niya magka-anak. Pero on workup, ang taas pala ng prolactin levels niya. So, nag-bromocriptine siya and all. So, bumaba, pero mataas pa rin yung parang bumaba lang for something pero mataas pa rin. So, ang ginawa, nag-MRI, nakita may mass pala siya sa pituitary gland. So, ang ginawa, pinatanggal niya. No? So, pinatanggal niya, tapos nag-normalize yung prolactin levels. Kaso mag-grouping, nag-lockdown. Ang schedule niya ng insemination, IVF is parang 17. O, di ba nag-lockdown ng May 15? Naka-schedule siya ng May 17. Hindi, March 15. Nag-lockdown. March 17 siya naka-schedule for IVF. Imagine mo, ang long way na, no? Tapos, edi syempre, na-postpone, hindi magtutuloy kasi close, sarado lahat. Then, nung time na lumuwag-luwag, in-offer ulit sa kanya if she wanted ulit na magpa-IVF. Eh, parang wala, nang hinanay yung loob niya, ayaw niya na. So, hindi niya nang tinuloy. Baka hindi na talaga para sa kanya, di ba? So, yun. Nakakalungkot, no? Eh, yung ibang nga nasa kalsada na lang, yung mga palaboy-laboy. Ang dami-daming anak. Tapos, yung mga gusto magka-anak, na capable naman magpamilya, wala. So next, yung tamoxifen, we have discussed this earlier. It is the first selective estrogen receptor modulator. It is the drug of choice for advanced breast cancer all ages. However, it can cause hot flashes. Danazol, ito naman is used for endometriosis. So, endometriosis, dito naman yan sa lining ng uterus, no? So, endometriosis. So, it is ang ginagawa nito is that it has a negative feedback inhibition to decrease ovarian steroidogenesis and regression of endometriomas. So for abortion naman, kasi mifepristone is the more notorious one, no? And it can cause prolonged bleeding, kaya ma-abort talaga yung baby. So, for androgens naman, we have testosterone, natural testosterone, and dihydrotestosterone. And also anabolic steroids, no? Like nandrolone, oxandrolone, and the others. So, androgenic steroids are also used to for the replacement of androgen replacement therapy. So, ito yung mga ginagamit niya, Jigsairus, mga ganyan. No? Testosterone, no? Na-inject sila ng testosterone to increase testosterone levels, no? Kasi normally, sa physiology niya, ang testosterone, mako-convert to estrogen. Pero sa kanya, kailangan niya mag-supply ng estrogen para mawala yung fat, di ba? Nakita niyo naman ngayon, di ba nagpatanggal siya ng breast? So yan, nag-inject siya ng testosterone para maging boses lalaki din siya, gano'n. And usually, binibigay siya sa mga patients with primary testicular insufficiency, hypergonadotropic gonadism, delay in growth, and osteoporosis. Parang may napanood ako sa Jessica. So, yan. Yung all this life, ang alam niya lalaki siya, pero babae pala siya. Parang gano'n. Napanood niyo ba yun? Sorry. So, ako lang. So, yun, may mga ganun tayong meron naman parang babae siya, pero yung pala lalaki siya. So, yun, yung mga bibigyan yan. No? Para mag-improve yung testicular, yung ano niya, mag-improve yung testicles niya. So, yun. And ang side effects naman in women, syempre magkakaroon siya ng hirsutism, kaya nagkakaroon na rin sila ng armpit hair, na yung voice nila nag-improve, nagkakaroon sila ng parang clitoral enlargement, so parang mukha na rin siya penis, no? And deepening of voice, so nagiging masculine sila pag injected with testosterone. Sa lalaki naman, yun, may cause impotence, decreased sperm count, gynecomastia, and other psychological changes. Finasteride, ito naman, anti-androgen, which can block the conversion of testosterone to dihydrotestosterone to prevent enlargement of prostate. So, finasteride. So, glutamine, sabi na rin natin to, it is an anti-androgen, an androgen receptor antagonist that can induce prostatic regression. So, pampaliit ng prostate. So, let's move on to the other part, yung corticosteroids. So, corticosteroids are produced and released by the adrenal cortex. And there are different types. We have glucocorticoids. So, ang natural is yung mga cortisol, and the other one is synthetic. And there are different categorization based on the duration of act. Kung gaano katagal siya. So, the long-acting one is lethal, metazone and dexamethasone. So, these are the effects. Masyado marami yan. But, yeah. Next is mineralocorticoids. Pakibasa na lang yung mga adverse effects, mga effects and adverse effects. Mineralocorticoids, the natural one is the aldosterone. It is the main and most important mineralocorticoid, and the synthetic ones. So, fludrocortisone is the most commonly prescribed salt-retaining hormone. So, they are used for adrenal insufficiency, and the adverse effect is hypertension. Next, we have diabetes mellitus. Diabetes mellitus is the disorder of glucose metabolism that result from an absolute or relative lack of insulin. And there are two types, type 1 and type 2. Type 1 is insulin dependent, EM. Type 2 is non-insulin dependent, EM. So, usually in type 1, they are prone to ketosis. They are most seen in children and young adults. No? So this is due to beta cell destruction. So ang nangyayari, no insulin is produced. Pag type 2 diabetes naman, this is adult onset. It is usually due to lifestyle. Ang meron insulin pero may insulin resistance. And we give insulin in conjunction with oral hypoglycemic agents. And also for pregnant, no, we have gestational diabetes. So ito naman, tumataas lang yung sugar during pregnancy. Pero after na-deliver na yung baby, wala na eh. Normal na ulit ang sugars. And in this type of patient, we give insulin. We don't give oral hypoglycemic agents. So insulin, as a background, it is secreted by beta cells or pancreas. The precursor is proinsulin. It is for storage and anabolic hormone of the body. So these are the effects of insulin. Pakibasa na lang. And there are different types of insulin. So ito, paki-memorize po ito, no? Kasi important yan, no? Important na alam niyo kung sino ang rapid acting, sa short acting, intermediate acting, and long acting. So, usually yung mga long acting, they are the newer ones. Like insulin depaner, insulin glargine, they are long acting insulin. So, yung mga rapid acting, we have insulin Dispro, aspartame, glucine. So, yung sa mga government hospitals, ang mga available lang dyan si regular insulin at saka si isotonic insulin. No? They are delivered through a subcutaneous injection. Meron yung portable pen. Nakakita na kayo ng pen, insulin pen. Para sa ballpen lang, no? Or may mga continuous pump, insulin pump, and inhaled insulin. Adverse effects include it can cause hypoglycemia, no? And it's relieved by glucose formation and lipodystrophy at injection site. Kasi everyday nag-inject sila. That's why important na niro-rotate yung injection site to prevent this lipodystrophy. Parang ikimiting yan, parang yung mark ng mga injection. That is lipodystrophy. And there are different oral hypoglycemic agents. So, first one is sulfonylureas. No? Insulin secretagogues, ibig sabihin, it promotes insulin production, no? By the pancreas. So, number one is sulfonylureas, no? And meron siyang first generation and second generation. So, yung second generation, yun na lang yung currently available sa market. No? We have glyburide, epicide, imeteride, no? Second, we have meglitinides. So meglitinides, we have repaginide and nateglinide, no? And ang mechanism nito is that it binds to the SUR1 receptor of the beta cell to stimulate pancreatic secretion of insulin. And repaginide, it is used as monotherapy or in combination with biguanides. So as the same with nateglinide, no? So ito yung widely used natin ni si metformin. Si metformin is a biguanide, no? So biguanide, it increases the hepatic sensitivity of insulin, and it does not increase weight or provoke hypoglycemia. And for patients whose hyperglycemia is due to ineffective insulin action. So important dito na sabi, bumabang nanghihina daw dahil sa metformin. Ang totoo niyan, ang maganda sa metformin, hindi siya nakaka-cause ng hypoglycemia, kaya safe siya, no? So yan, ang pinaka-ano lang naman is yung lactic acidosis, no? But less common. And sa mga early phases na umiinom yung patient with metformin, diarrhea, abdominal discomfort is very common, no? However, hindi na siya pwede sa mga mataas ang creatinine levels, no? So next we have ayan, so next insulin sensitizer, we have thiazolidine diodes. So ang example niyan is si pioglitazone and rosiglitazone, no? It increases the post-receptor defect in muscle and adipose tissues, and it increases the insulin sensitivity of muscle and adipose tissues. Si pioglitazone can be monotherapy or in combination with metformin, as the same with rosiglitazone. Adverse effect is fluid retention. Next, we have alpha-glucosidase inhibitors. Ang mechanism of action nito is it competitively inhibits alpha-glucosidases to decrease postprandial digestion and absorption of starch and disaccharides. So it can cause flatulence, diarrhea, and abdominal. Next, we have exenatide. So it is the first incretin therapy that become available for the treatment of diabetes. No? The mechanism is that it potentiates the glucose-mediated insulin secretion. And currently, no, parang nagbo-boom ulit itong si exenatide since para may mga ongoing studies regarding this drug, no? For diabetes. Next is pramlintide. This is an amylin analog that modulates postprandial glucose levels. Ito isa pa sa mga common na si sitagliptin, marketed as Januvia. It is a DPP-4 inhibitor. So, si linagliptin, pag mataas ang creatinine, ito yung binibigay natin. So, ito si SGL2 inhibitors. So, ito rin isa sa mga newer oral hypoglycemic agent. So, since it is designed to reduce hyperglycemia by increasing urinary glucose clearance. So ito, ang pinaka-drawback lang sa mga gamot na to is that patients are prone to urinary tract infection. No? Kasi yung ihi mo, doon pupunta yung glucose. And these drugs are used for not only, they are also known for cardiac remodeling. Kaya ginagamit na rin siya, not just for diabetes, but also for heart failure. May mga newer studies na yan. So next we have the agents that affect bone mineral homeostasis. So calcium and phosphate are the major mineral constituents of the food. We have the parathyroid hormone and the vitamin D as regulators of calcium and phosphate homeostasis. No? So PTH normally increases calcium and decreases phosphate. And PTH is the principal regulator of the principal regulation PTH is regulated by calcium. No? And PTH stimulates production of vitamin D by the kidney. However, 1,2,5 vitamin D is the one that suppresses the production of PTH upon threshold levels. No? Vitamin D is a fat-soluble vitamin. It is a prohormone, and it regulates calcium and phosphate levels. And of these natural metabolites, only vitamin D are available for this type of vitamin. 1,2,5 hydroxy vitamin D is available for clinical use. And it can be found in other sources like plants, animals, and the skin, which is 7-dehydrocholesterol activated by UV light. Sorry. Andray na nila muna kami lang. On the other hand, meron tayong tinatawag na condition like osteoporosis. This is the abnormal loss of bone predisposing to fractures. And raloxifene, it is the one that's given to protect against spine fractures. It reduces also risk of breast cancer, and it does not prevent, however, it does not prevent hot flashes, for postmenopausal women. Teriparatide, it is a recommended form of parathyroid hormone that stimulates bone formation, and calcitonin. So this is a modification of vitamin D that lowers calcium and phosphate by the actions of bone and kidney. It is used for the treatment of postmenopausal osteoporosis. To increase the bone mass and reduce spine fractures. Bisphosphonates, these are potent inhibitors of bone resorption. Ibig sabihin, yung resorption, yung cell, nagdedicate yung bone cells, Parang pinatitibay niya yung bones. So, yung alendronine, trisendronine, and ibandronine. And usually, we recommend this for patients na hindi na kaya mag-intake ng calcium supplements, or hindi na kaya kumain ng adequate, or elderly. Calcium is the most frequently prescribed, for patients with hypocalcemia or patients with deficient calcium in the bones. And traditional dosing is that kailangan is 100 milligram per day, no? In a quart of, it is about a quart of milk, no? And intravenously, we can give calcium gluconate, calcium chloride, and calcium luceptate. However, calcium gluconate is the more preferred because it is less irritating to the veins. The oral one, no? Ito yung mga oral one, oral preparations for calcium. And the most acceptable is calcium carbonate since it has a high calcium, it is low cost, and it has antacid properties. Also, we can give hormone replacement therapy so that there's an increased estrogen. So relatively, yung hindi magkakaroon ng bone resorption. Meron pa tayo two PowerPoints for for endocrine. We have hypothalamic and pituitary hormones. So as we remember, no, yung hypothalamic pituitary endocrine system, meron siyang dalawang lobe. Yung hypothalamus natin. Sobrang girly yung form, no? I don't know bakit nagkaganyan. Hindi ko alam. So, meron siyang, di ba, two compartments, the anterior lobe and the posterior lobe. The anterior lobe produces and releases hormones such as growth hormone, thyroid hormone, adrenal hormone, LH, FSH. And the posterior lobe, which is does not produce any hormone, but it is a storage hormone, no? A storage lobe for other hormones. So as all of these hormones in the anterior pituitary act through G protein coupled receptors except growth hormone and prolactin, which acts as a JAK-STAT receptor. So this is a summary table of all anterior pituitary hormone. We have growth hormone, thyroid stimulating hormone, adrenocorticotropic, follicle stimulating hormone, luteinizing hormone, and prolactin. So, nakalagay na yung mga target organ at saka yung mga inhibitor. So, pharmacological application is that if there's a deficient, and we supply, we replace. Pero if there's an excess, and yun yung isang natin problem, no? We need to antagonize that excess. So it can be used for diagnosing endocrine abnormalities. So number one, we have growth hormone. Growth hormone or HGH is also known as somatotropin. It is the most plentiful anterior pituitary hormone. It secretes insulin-like growth factors, no? IGF promote growth of body cells, protein synthesis, tissue repair, lipolysis, and elevation of blood glucose concentration. The mechanism action, as I've said a while ago, it mediates the receptors of the JAK-STAT cytokine together with prolactin. Somatropin, it is a recombinant HGH, which is identical to the regular HGH and Somatren. Somatropin injection, this is a long-acting preparation of HGH, no? Very important. So it is indicated for Prader-Willi syndrome. So this is a deficiency of growth hormone, no? So stunted yung growth na obesity, and carbohydrate intolerance. Turner syndrome, no? And idiopathic short stature, yung mga maliliit yung height, no? Mecasormin, this is a complex of recombinant human IGF and human insulin-like growth factor binding 3. It is used for severe IGF deficiency, not responsive to the exogenous growth hormone. The most common adverse effect is hypoglycemia. Kasi nga, increase in growth hormone, also an increase in insulin growth factor, insulin growth factor. So, other growth hormone antagonists include octreotide, bromocriptine, and pegvisomant. Somatostatin, on the other hand, is found in hypothalamus, and it is an inhibitor of growth hormone, glucagon, insulin, and gastrin. Therefore, it has a limited therapeutic usefulness. Octreotide, it is a somatostatin analog, which is 4 times potent than somatostatin. It reduces the hormone-secreting tumors like acromegaly, carcinoid syndrome, gastrinoma, and others. Bromocriptine, it is a dopamine receptor agonist that reduces the production of growth hormone. Pegvisomant, it is a PEG derivative, which is used for the treatment of acromegaly. So next we have the gonadotropin. Gonadotropin, it includes FSH and LH. So FSH is responsible for the ovarian follicle development in females and spermatogenesis in males. Luteinizing hormone naman, it is responsible for the stimulation of T cells during the menstrual cycle. Sa males naman, it is involved in the stimulation of production of testosterone by the Leydig cells. Human chorionic gonadotropin, this is an indicator ng pregnancy, di ba? It is excreted in the urine and it stimulates the corpus luteum of the ovary to continue the pregnancy. Gonadotropins are used in infertility and controlled ovulation hyperstimulation. So ovarian hyperstimulation syndrome, where there is an ovarian enlargement, ascites, hydrothorax, and hypervolemia, we can give gonadotropins, and also for gynecomastia. And there are different commercial gonadotropins available. We have the human menopausal gonadotropin. It is extracted from the urine of postmenopausal women. And there are different forms, no? So the urocolotropin is a purified extract from the urine of postmenopausal women. Polytropin alpha and beta are other preparations extracted also from the human urine. However, these have shorter half-life. Nutropin, this is a of infertility women. For your gonadotropin are also used, but it is based on the weight rather than the units of activity of the patient. For gonadotropin releasing hormone, so these hormones stimulates the release of LH and FSH in the patient. So dito, di ba, we have the GnRH agonists. So ang mangyayari dito, so agonists, ibig sabihin, promote the production of FSH. So ang mangyayari, GnRH, so for the patient to produce more testosterone, diba? In males and other. Pero, pagka na-reach na ng katawan ng ng patient, yung na-detect niya na sobrang taas na ng testosterone, it will send a negative feedback to stop FSH and LH production. Okay? Pag GnRH antagonist naman, so ano nangyayari? It blocks the receptor so that it will not produce more FSH and LH, therefore not producing testosterone. Okay? Malinaw? Ito, it relies on the negative feedback. Ito hindi na. Direct, ipo-control nyo na yung pag-produce ng more FSH and LH. So gonadotropin is an acetate salt of synthetic human GnRH, and there are analogs that are used to become GnRH agonists. So these are used for patients with female infertility, male infertility, and to diagnose LH responsiveness. That excessive testosterone is the cause of prostate cancer, no? And otherwise, sa estrogen din, no? Sa breast cancer, sa uterine cancer. So, ang gusto natin dyan is to limit yung excessive production of hormones. So, for control of our hyperstimulation, bibigay natin yung glutamate na parang for endometriosis and leiomyata. So, yeah, yung gulay. So, makikita nyo, yung gulay is the most commonly prescribed, no? GnRH agonist. For GnRH antagonists, we have relics, no? Ganirelix and centronirelix, no? That prevent the LH surge during controlled ovarian hyperstimulation. The growth hormone, no? It resembles the growth hormone in structure and is the hormone responsible for lactation. And dopamine is the prolactin inhibiting hormone. So, kaya sa naalala yung kwento ko before, no? Ang ginamit, nung nalaman may hyperprolactinemia, ang binigay agad is bromocriptine to inhibit further production ng prolactin. So, yun yung mga binigay natin. Bromocriptine, taberduline, furludine. Yeah. Dopamine agonist also is a standard treatment for hyperprolactinemia and also for Parkinson's disease. Kung naalala. Binibigay din natin yan. So, these are given to patients to cause construction. Ang babae naman talaga may normal oxytocin, no? Kaya pag makikita nyo yung mga hindi ko lang alam no, sa mga nanganak, lalo sa public hospital, sa private, I don't know. Sa public kasi, sige, mister, pinapapasok. Laruin mo ang nipples ni misis. Ganon. Release ng natural oxytocin yung babae. Sabi, di si mister, sige po. Tawa-tawa kayo dyan, ha? Pag kayo, paalala nyo ako pag may miss yung mister nyo, pinalalaro nyo sa inyo pag mga anak na kayo. Normal ka ba, ma'am? Yes na. So, hindi na pinalaro yung nipples. Pero, pag sige, laruin mo yung nipples ng misis. Basta, si misis, hindi ba ganun talaga. Pero nilalaro-laro pa yung nipples niya talagang. So, relatively kasi, oxytocin will promote augmentation of labor, no? Part of the, kaya nakakaawa na kasi after pa nila maglabas ng baby, edi syempre, palalaruin mo yung nipple sa kanila kasi kailangan pa nilang i-deliver yung placenta. Eh kasi pag hindi adequate yung oxytocin, mag-bleed sila. Ganun. Kaya nung first time kong nagpaanak ako, yung first time kong nagpaanak, tinawagan ko agad talaga yung nanay ko, parang sabi pa, thank you. Inire mo ako. Kasi normal delivery kasi ako. So, makakatas ko lang. So, yes, buti lang umiyak siya agad. Kasi pagka hindi umiyak yun agad, at a certain time, syempre meron yung something problem, no? ICU agad yun. Pero pag umiyak yun agad, ilalatch agad yun sa blood matter. So, it is contraindicated for patients na baby na detect na may fetal distress na premature, mayroong problem sa fetal presentation, cephalopelvic disproportion, kita siya yung ulo, no? Doon sa puerta ng mami, and may tendencies for uterine rupture. Ano dahilan ba ba't kaya CS? Coil or coil. So atosiban, this is a modified form of oxytocin. It is used for preterm labor. So tocolysis. Ibig sabihin, ito naman, pinaprevent naman ito yung, di ba may mga early premature nagpo-contract. So yun, to prevent that contraction or preterm labor, binibigyan ng atosiban. So vasopressin, this is an anti-diuretic hormone naman. This is used for as a response for falling BP, no? And there are two types of G protein, no? B1 and B2. So this vasopressin regulates yung blood pressure. It is indicated for the for pituitary diabetic insipidus and for variceal bleeding. No? The smopressin, so this is a variant of vasopressin. It is a long-acting synthetic analog. So it is a treatment for pituitary diabetic insipidus. And also there are antagonists for tolvaptan and tolvaptan. This modulates, this is used for hyponatremia in patients with heart failure. And the last for this endocrine lecture is the thyroid drugs. So the thyroid gland, it is composed of follicular cells, no, that produces thyroid hormone. Meron bang hyperthyroid dito, hypothyroid? Baka lang hindi na-detect. So, usually, si Miles, di ba makapansin niyo si Miles Ocampo, di ba mataba na siya ngayon? Para siyang angel of sin ngayon, di ba yung tsura niya? Kasi nakano siya hypothyroid na siya dahil tinanggal na yung thyroid gland. Kaya ko siya naalala kasi last week pinanood ko yung misconnections. Oh, alam mo, no? Grabe naman ito, bro. Talaga, misconnections yung kaya sa Netflix. Diba? Nakakabuisit siya doon. Grabe, parang patay na patay sa lalaki. So, yun. So, kaya ko siya naisip na example. So, it releases T4 and T3 hormones. It is responsible for normalization of growth and development, body temperature, and energy levels. So also, thyroid gland, meron siyang mga parafollicular cells na naka-embed sa likod ng thyroid gland. And it is responsible for the calcitonin levels. So the biosynthesis of thyroid hormones encompasses these steps. And ito yung target, tawag dito, Ito yung mechanism, yung pinaka pwede yung aralin, no? When it comes to thyroid gland. So, ito na yan. So, with IUD will transport it inside, no? It is inhibited by thiocyanine and perchlorate. So, it will oxidize, by the use of peroxidase, it will peroxidize, no? It will be inhibited by these drugs. Then it will enter, IUD will enter the thyroid globulin, forming MIT and EIT, no? Attached to T3 and T4. Then proteolysis will occur, then it will be released in the blood as T4 and T2. So once it is released in the bloodstream, no, it will be inhibited by the following. So there are different thyroid preparation. We have natural and semi-synthetic. For the natural, we have desiccated thyroid. It is from hog, beef, and sheep. It contains T3 and T4. It is taken orally. No? And thyroglobulin is partially purified pork thyroglobulin. No? It is expensive than thyroid extract. And levothyroxine is the drug of choice for the thyroid replacement and suppression. So ito usually iniinom by empty stomach, no? And lidotyramine T3. So ito hindi na siya masyadong, ako personally hindi pa ako nakakakita nito. Pero it is best used for short-term suppression of the TSH. So Lyotrix, no, it is another combination of T3 and T4, 4:1 ratio. It mimics the natural hormone secretion of the thyroid. So ito ginagamit to for patients na it's either hypothyroid siya or post-thyroidectomy. Kasi kung post-thyroidectomy siya, total thyroidectomy, wala namang produce ng thyroid hormone. For anti-thyroid drugs, ito namang anti-thyroid, ginagamit for hormonal, tawag dito, for hyperthyroidism pala. So we have thionamides. These are the drugs, major drugs for thyroid toxicosis. So it inhibits the following steps of thyroid hormone formation. We have metimazole, carbimazole, and PTU or propylthiouracil. Metimazole is 10 times potent than PTU. It is given once daily. Carbimazole is sa katawan, nako-convert din siya to metimazole, no? So it is a prodrug. PTU or propylthiouracil, it is also a drug that can be used to lower thyroid hormones. So it can cause placental barrier. So therefore, they are pregnancy category B. And there at the first trimester, diba? For the first trimester, ang preferred na is the metimazole. But in the second and third trimester, we give PTU. And the most alarming or threatening, most dangerous complication of thionamides is agranulocytosis. So pag mga ganito, we advise patient na mag-seek ng medical attention, magpa-admit, no? Anion inhibitors, it inhibits the anion uptake, no? So ito yung mga previously binibigay ito yung mga unang drugs pero hindi na ngayon binibigay. Iodine, it is one of the medications we give for patients having thyroid storm. It is in the form of local solution or in saturated solution of potassium iodide. It inhibits the organification of iodine and proteolysis, and in patients with who will undergo surgery, no, it decreases the vascularity, size, and fragility ng thyroid gland. That's why, minsan, bibigyan lang sila ng drops of SSRI. However, it can cause the following adverse effects. Iodinated contrast media, pero ngayon hindi na rin siya binibigay at So, iodine 131 is the only isotope used for the treatment of thyrotoxicosis. Ang ginagawa dito is that pinapainom yung patient, inilalagay sa isang isolated room for two weeks. Then, ang gagawin is inumin niya yung radioactive isotope. Tapos, nakakulong lang siya doon for 2 weeks. Hindi siya pwedeng lumabas. Kasi, ano siya eh. Meron siyang radiation. So, ang goal din doon is to destroy the full thyroid paradigm, no? Dati may mga patients, meron pa rin mga patients na nag-undergo dito. Ang advantage ito kasi is easy, effective, low expense, and absence of pain. However, hindi pwede yung patient dito na buntis. We've also beta blocker. Beta blockers are also given to patient kasi nga for patients na hyperthyroid, they can increase the heart rate of the patient. Usually, yung mga hyperthyroid, tachycardic, parang abis mapagod, mga ganon. And propranolol is the well-studied beta blocker for hyperthyroidism. And in summary, ito yung mga steps, no? Thyroid formation and damage expanding. Yung parang nasa picture, yun lang din. And the corresponding drugs. So, ang treatment ng thyroid, ng hyperthyroidism is with the use of thionamides like betamazole or BTU. Minsan binibigyan natin ng beta blocker if the patient complains of palpitations, and if palliative, kung sakaling yung patients meron pang ibang concerns, then kunyari nagkaroon ng thyroid storm or thyrotoxic event, we can give other medications like steroids and others. Pero pag kunyari hypothyroidism naman, meaning there's a deficit of thyroid hormone, we give levothyroxine. Ganun na siya kadali. Hindi na ako magbe-break para dire-diretso ng ligaya. And for the last topic, we have toxicology. Ito mabilis lang to kasi na-lecture parang kailan lang tayo nag-lecture, di ba? So toxicology is the study of science of poisons, adverse effects of treatment, and disorders to be used. It is coined by Matthew Joseph Bonaventura. And there are different branches of toxicology. So yan, hindi naman yan very important. But the effects of, extent of effect of poisons can be local, remote, or systemic. For the management of poison, important that we secure the airway of the patient, breathing, circulation, disability, and exposure of the patient. And for patients na inhalational yung kanyang toxic compound na expose siya doon, we need to decontaminate the patient. Meaning, we need to remove immediately yung exposure niya to that toxicant. So pag inhalational, we give the patient with 100% O2 support, or if the patient is unconscious, we intubate the patient, or if patient has difficulty of breathing, we can give beta agonists such as bronchodilators. For dermal exposure like acid, no, we expose the patient, we rinse the wound with copious amount of water. Pag ocular naman yung exposure, we irrigate it with isotonic solution. And for gastric ingestion, we can lavage the patient, no, by activated charcoal. We can do gastrointestinal dialysis or dilution by even saline solution. It is an old practice that we give ipecac, no, or we make the patient vomit, no? Or para mailabas niya yung toxic substances, hindi yan highly recommended. And there are extracorporeal methods like hemodialysis, no? Or hemoperfusion. Ang difference lang naman ng hemodialysis sa hemoperfusion is that it connects another filter, no? But the process is still the same. And peritoneal dialysis, there's a tube that we connect, no, to filter the toxicant. And dito naman sa toxicology, ang mapapayo ko lang is, sa board exam is, alam nyo lang yung antidote, yun. Yun yung mga important. Antidote, ano yung, ano doon, yung characteristic ng, ano na yun, ano yung, ano ba yun, yung itsura ng ganyung toxicity, gano'n. Yun yung mga possible na lalabas. So, antidotes are therapeutic substance used to counteract toxic actions. And it is classified based on the different, based on the site of action and mode of action. So, for the, according to the action, we have chelators, we have antidotes that detoxify the poison, and there are antidotes that can decrease the rate of conversion of poisons. Also, there are competitive inhibitors, no, of some poisons, and blocks the receptor of the toxic to block the blocks the receptor to block the toxic effect of that poison. And sometimes it bypasses the effect of the poison. For the classification according to the mode of action, we have the physical antidote. So dun pumapasok si adsorbent like activated charcoal, which is the considered as the universal antidote. So pakitake note yun, no? And coating naman is a process wherein we mix egg and milk to coat the mucosa, that will make a coat over the mucosa to prevent further absorption of that toxicant. So mga, for example, mga ano yan, sa mga 1 to C, dissolving is ingestion of 10% alcohol or glycine for carbolic acid. So we also have chemical antidote. So for example, yung mga metal chelators that will form an inactive complexes that will eliminate, that can be eliminated by the kidneys. So number 1, complex formation. Second one is metabolic conversion. So ang mangyayari, yung toxicant will be added with the antidote to make a less toxic end product. So for the physiological and pharmacological antidotes, it has 5 mechanisms. So number 1 is preventing the formation of toxic metabolite. more effective when given effectively before the toxic metabolic activation. No? So ang goal dito is mabigay siya before mag-push through or ma, may mag-effect or mag-react yung toxic metabolites. Second is facilitation of a more rapid or complete elimination of a toxicant. For example, molybdenum and with the reaction, molybdenum and sulfate when reacted to copper will make a water-soluble complex which is excretable, no? Excretable via glomerular filtration. Next is by competition. No? So we have competitive inhibitors instead of the toxicant, yung antidote yung magiging it has a more affinity to the receptor, therefore siya yung sasaksak than the toxicant. Pag non-competitive inhibitor naman is that it connects to a different site where it can cause variation in the configuration of the receptor. So, yun yung ginagawa ng naloxone and naltrexone, competitive antagonism yun, and at the same time, yung sa clobazamine and sa atin. Non-competitive antagonism, ang examples dan are calcium gluconate, pralidoxime, and diacetyl monoxide. The fourth one is blocking receptors responsible for the toxic effect. For example, no? So, yung mga acetylcholinesterase, no? Ang ginagawa, yung organ, for example, organophosphate pesticide, no? Ang ginagawa niya, binablock yung acetylcholine. Yung dapat ang acetylcholine, dapat i-destroy siya ng acetylcholinesterase. Pero ang ginagawa niya, binablock ng organophosphate pesticide yung acetylcholinesterase. Kaya nangyayari, nagpo-proceed yung mga nagpo-proceed siya sa receptor, therefore nagkakaroon ng response. Ang goal natin, hindi siya mag-proceed. And lastly, by aiding the restoration of a normal function. For example, oxidant in the presence, ano nangyayari nagkaroon ng methylglobin, no? So, yung methylglobin niya, when added with methylglobin group, iiwalay niya yung normal na iron, normal hemoglobin to restore into its normal state, no? So there are different para management, no, for different toxicants such as, for example, exposure to carbon monoxide. Kasi ang carbon monoxide is a byproduct of incomplete combustion. So ang gagawin natin, kasi ang carbon monoxide has a strong affinity to hemoglobin than the oxygen. So, ang mangyayari, mas magbabayad siya doon. Yung mga, for example, masunog, na tira sila sa loob, tapos yun, naimatay sila, so yun nga yun. No? So, ang treatment lang dyan is to expose them to high doses of oxygen. Second is hydrogen sulfide. So, usually, ito is hydrogen sulfate inhibits the cytochrome oxidase required in the electron transport chain. The antidote is sodium nitrite. Cyanide is also, ito yung familiar kayo sa mga tahong-tahong, yung mga red tide. No? Because yung red tide, ang ginagawa nyo cyanide patient yan. And when na-intaken ng humans, yung mga fishes and other seafoods na mayroong cyanide, pwede ka magkaroon ng different pwede kang magkaroon ng vomiting, mga non-specific side effects. So ang antidote dyan is amyl nitrite, no? And sodium thiosulfate. And also cyanide binds to hemoglobin. So meron yan mga difficulty of breathing, ganyan, no? That's why kaya tayo iniiwasan natin yung mga ganun, yung mga pagkain ng may red tide. So next, we have organophosphates. So organophosphates are compounds found in pesticides. So organophosphates inhibits acetylcholinesterases, and the antidote is atropine and palidoxime. For nitrates and nitrites, no, they can be seen with dizziness, headache, hypotension, and cardiac arrhythmias. And the treatment is methylene blue. So different poisons can be intaken, can be there are different factors that influence the effect of poisons in different people. So, pwede silang pumasok by different routes. Pwede na inom mo siya, pwedeng sa skin, or pwedeng na lang hap mo. No? And it depends on the concentration of the toxicant. No? Minsan naman, pag hindi naman masyadong marami, wala rin namang effect sa patient. It is also depends on the age, no? And the more susceptible is the children and the elderly. For example, teratogens, no? Like thalidomide, ACE inhibitors, they ethyl tetracycline and alcohol, no? There are no teratogens, no? And previously, they are given to pregnant women. But on further studies, they are known to cause abnormalities sa mga pregnant patients. So mga household and industrial and household toxicants, there are different toxicants like alcohol. Example is ethylene glycol. So dito, ito yung sinasabi nilang nakainom daw ng mga lambanog na akala nila lang daw, no? Pero yung pala, yung mga gamit sa kotse, no? So when it taken, when these are taken by patients, no, it forms an oxalate that is detrimental to the system, no? Oxalate will be converted to oxalic acid, and this oxalic acid is toxic to the human body. It can cause CNS abnormality, confusion, headache. Then after 12 to 24 hours, it can affect the heart and the lungs. After 24 to 72 hours, it can cause renal failure. Then later on, it can cause death. No? And the treatment is the administration of ethanol, leucovorin, and fomepizole. So yung formaldehyde naman, kasi di ba previously may mga nakakainom ng formaldehyde, no? It can irritate mucous membrane, and one way we can give this, we can aid these patients is to decontaminate, no? Because if possible, pwede tayong magbigay ng supplemental oxygen, or kung sakali, pwede kami mag-lavage. So, paki-remember lang din that acid can cause coagulative necrosis, no? And alkalis can cause liquefative necrosis. Ano yung sabihin nun? Yung liquefative necrosis, it can dissolve. No? For example, yung ice. Pag na lagyan nyo ng bleach, no? Pwede nyo yung matunaw yan. No? For example, rain. No? Pero pag coagulative, it can cause, di ba pag nasunog, sino na nakaano ng acid dito? Nasunog na. Pwede siya mag-cause ng sugat para coagulative, para siya mag-cause siya ng sugat lang dun sa part na yon. No? Pero pag alkaline, for example, yung mga puminom ng zone rocks, ganyan. Meron ako dati ganun eh, parang iyak-iyak na siya. Parang, sabi ko, gusto ko siya. Parang hindi ko alam maawa ba ako or maiinis ako kasi ang dami naman pwedeng pampakamatay tas nasa rocks pa yun namin. Kasi pag nangyari niyan, since basic ang zone rocks, pwede niyang lusawin yung internal organs. No? So, mangyayari na, pag nalusog yung esophagus mo, medyo mangyayari na, ang gagawin kasi ng procedure is, ikakabit na colon na, no? Yun yung next. Kasi tatanggalin na yung natunaw eh. No? Mas pinahirapan mo lang yung sarili. So, nakakainis siya. Naalala ko lang. Heavy metals, ito, marami talagang tinatanong dito. Siguro majority ng toxicology questions. Kaya ini-skip ko na lang is more on sa mga metals. Yung mga heavy metals, ganyan. Kasi yun ang mga tinatanong nila sa board exam. So, for example, ito, leferoxamine is a drug of choice for iron toxicity. Yan ang mga luhat na tinatanong. Hindi na yung mga nauna kong sinabi. For example, ito, British anti-Lewisi. It is the first chelator clinically used. It is used for the following elements. DMSA, used for these elements. So yan, pakitandaan nyo mga yan. Malay nyo sa example yung dito lumabas. For diethylsilamine, so it is used for copper toxicity and for the other elements. Calcium disodium etta, this is used for the following elements. Wala na ako ano yun, kaya niya nagpapsadulit. And ito, walang kamatayan, kahit yung review namin, sinasabi talaga to si Salvarsan upon si OCT. At ayan, kasama yan sa kailangan yung aralin. No? Kasi it's either si Salvarsan or si RU486. Yan ang lumalabas. So these are arsenic and can be treated with val or penicillin. It's lead. So it can cause the following manifestation. The treatment is calcium, disodium etta, and DMS. Beta disease is a condition where cadmium displaces calcium. Kasi ang calcium and cadmium are relatively with the same weight. No? Mga halos magkalapit yan sa periodic table, di ba? So cadmium can displace calcium and the effect is this. Pinabata disease, ang pinaka-highlight dyan is that it can cause acrodyne. So, yan. That figure, and the treatment is val for inorganic mercury and sodium formaldehyde sulfoxylate. Kaya nga, di ba yung mga mercury, naabutan niyo pa ba yung mercury na iron thermometer na may mercury? No? So, ngayon, hindi yan na-advise na gamitin kasi toxic element talaga yung mercury, no? When, talagang kailangan mong evacuate ng room pag may mercury na ano dyan. Iron, no, can cause gas when excess, and the treatment is leferoxamine. Ito, si Wilson disease, so it can cause the cancer patients immediately. Hindi niya, no? So for pesticides and insecticides, we have lindane, chlordane, and EDT. So yung lindane, yung sa ano na yan, dati hindi magamit. It is an agricultural insecticide. Pero ngayon, banned na yan dahil sa kanilang toxicity. It can cause seizure, tremors, headaches. Si pyrethrin, si Lisha, sino ang mga nagkakuto dito, no? So, yan, no? So, the mechanism of action is that it increases sodium conductance and reduce calcium conductance. So, these are parang mang ginagamit for mga rodents. Coumarin, yan, it is a rodenticide. So it is the source of warfarin, no, yung coumarin. Kaya may ang warfarin ng innovator din is coumarin. Yung generic yung brand name niya, coumarin ang warfarin. It is from coumarin, di ba? And the manifestation is bleeding and the treatment is vitamin D. White phosphorus or yellow phosphorus, it presents as hypocalcemia and cardiac arrhythmias, and the treatment is copper sulfate. Alam mo, sa totoong buhay nito, ang weird nito kasi, siya, kakaiba, mabasa-masa siya. Weird, basta yung phosphorus na yun. Kasi hindi siya pwedeng expose sa water kasi puputok siya. Paraquat and diquat, they are known herbicides. So they are used in agriculture, no? Sa mga ibang pastures, ginagamit pa yan. Pero these are known to inhibit superoxide dismutase and can cause pulmonary fibrosis, pulmonary edema, hemorrhage, pancreatitis, and CNS. So, sa mga ganyan, no, ang kailangan lang talaga is number one, to remove the patient immediately from that area na may mga herbicides, ganyan. And symptomatic management. Aspirin, toxicity, excessive aspirin naman, aspirin pa lang. So, aspirin, so can cause salicylate, no? And metabolic acidosis when excess. And these are the manifestation when there's toxicity, no? Pero wala naman tayong dito sa aspirin. If there's a toxicity with aspirin, symptomatic management is enough. For acetaminophen, so there's stop QI when that is formed, no, due to metabolism of acetaminophen. And the treatment is not. Isoniazid, so it is known to inhibit MAO and inhibit lactate dehydrogenase in the core cycle. So isoniazid when taken in excess, no, can cause hepatotoxicity. So ginagawa lang sa isoniazid, relatively safe pa rin siya, but we give symptomatic management. Pag sinabing symptomatic management, kung ano lang yung condition ng patient, hindi nangyayari. Kunyari, may respiratory acidosis siya, control mo yung acidosis. Okay, but walang standard. For example, wala siyang antidote as present. So for the drugs of abuse, we have opioids and opiates. So the treatment for any opioid overdose is naloxone. For sedative hypnotics, so when it includes benzodiazepine, barbiturates. So the treatment of this is flumazenil. Hallucinogens like lysergic acid, diethylamide. So the treatment is mainly supportive. We hydrate the patient. No? Usually kasi mga LSD, these are party drugs, no? So yung mga mahilig pumarty dito. Amphetamine, ito naman yung mga shabu, no? Shabu like ecstasy, cocaine. So these can directly bind to adrenergic receptors, kaya hyper yung mga ganitong patients, no? And it can manifest as hypertension. So relatively yung mga patients with toxicity or excess in shabu, they can have hypertensive emergency. So we just control the BP by the carnitine, the betalol, and sodium nitroprusside. For hallucinogens, we have phencyclidine. It is known to cause dissociative anesthesia. So the treatment is benzodiazepines. For marijuana, so it is presented with rhinitis, tachycardia, and bizarre behavior. So parang, sino nakakita na naka-marijuana? Pag sinabing bizarre, kung ano nung ginagawa niya. Basta, naalala ko yung mga friends ko nun. Hindi ako nagmarijuana. pero may mga friends ako before na wala, parang hinihila yung isang friend ko. Eh, sabi niya, hindi na okay siya. Bakit ko siya hinihila? Ewan ko, hindi ko rin alam, pero hinihila ko lang talaga siya. So, parang, ano? So, isa naman, ikot ang ikot. Isa naman, umiiyak siya doon sa isang tabi. Parang siyang wala sa sarili, pero aware siya sa ginagawa niya. So, that is bizarre behavior. Ethanol, ito, paborito natin lahat na ito. Wow! Oh, pa-inosente, hayop. So, ethanol, it is a recreational, no? Pero sino sasabi sa talagang minom, di ba? But it can cause serious depression, kaya ka nalalasing, di ba? Metabolic acidosis when excess and hypoglycemia. Pero in patients with kasi minsan darating yung mga patient na yan, parang kala mo arrested kasi wala ka sa sarili. Pero pag mamaya niyan, na-hydrate na. Usually kasi ang ethanol kasi will make you dehydrated or kaya nga di ba may chaser, no? Kaya may juice. Yung iba naman, sobrang naman naka-juice talaga. Kala mo naman, juice lang na talaga inihanda eh. Di ba? So, relatively, we give hydration with glucose. No? Kaya may pulutan, may mga kasi na-dehydrate. At the same time, naging hypoglycemic ka din. No? Kaya may mga pulutan. Yung iba naman, sobrahan naman sa pulutan. So, pulutan na lang ang pinunta. No? And we also give vitamin B, no? Sinahalo namin sa swero at saka nagbibigay kami ng direct IV. Ako, alam na nila. Magre-ready. Actually, ito yan. Sa medical, sa mga magme-medical dito, medicine. So, lalo pag 31, di ba nga, duty ka, may mga times nga kami yung time namin, nasa clinic ako. Duty kami pag 31. Di ba makikita niya sa hospital yung mas clinic, nagkakaway-kaway yung mga doktor, gano'n, di ba? Ano yun? Talagang wasakan yun. As in talagang may nakaredy na ng nakaswero sa kung sino malalasag, edi sasaksakan lang yan, hydrate na lang yan mamaya. Tapos, wasakan talaga yun. So, kawawa yung mga patient talaga. Oo. Ganon. Yun yung real talk talaga pag and yun yung nakasanday yung mga B-complex, mga ganyan. No? In case may mga talagang mawawasak during that time. So, kaya mga ladies din nga, no? Kasi dami nabubulagan, hindi ko ba maintindihan bakit pa sila bubulagan. Gusto nila lahat, gusto nila surgeon, kasi yun yung pinapalabas sa Korean novela at saka kay Annalyn. No? Ang dami kasi gusto mag-surgeon, pero pag nalaman nila kung sorry, tinatouch talk with surgeon. Kaya di ako nag-surgery. May opinion lang naman yun. Pero, yan. Hindi kasi wala naman nag-highlight ng, for example, internal medicine, ganyan. Wala naman eh. Puro surgeon, kaya parang yung iba, gusto ko maging surgeon parang ng full. Di ba? Sa totoo doon, hindi naman natutulog, hindi naliligo. Di ba? Kami hindi lang natutulog. Pero ito. Pero sila hindi naliligo, tapos walang upo. Di pwedeng umubo, no? Alam ka namang iwanan mo nakatiwang mo yung siya, no? For example, pancreatic surgery, tatagal pancreas, we will procedure minimum ng 17 hours na procedure. O, hindi mo lang pwedeng iwanan yung nakatiwang lang yun, no? Kasi mga facial surgery, minsan 24 hours, sabi ko, no, ayoko, paalaki na. Yun nga lang, malaki ang bayad sa kanila. Kasi nga, with that skill, kaya nilang magwakwak ng mukha or what, bahala sila sa buhay nila. So yun. So mga magme-med lang. Walang pilitan. Kasi it's a trap. Joke. So we proceed to zootoxins. So ito, nilagay ko itong table na ayan. So ito, nilagay ko ito for you to familiarize lang. Hindi kasi ako naniniwala sa memorize talaga. Familiarize yun na lang. Kasi, hindi, pero kasi yung time talaga namin, lumabas itong sisigwat toxin. This one. This one. Kaya ito, pakitandaan na lang to, no? So this is a summary table of most common zootoxins, no? And their source. Pero ang amazing nung nakakita ng, may recently naman ako sa YouTube about puffer fishes. Meron di ba yung mga, di ba, sa Japan, required sila na may license. Because meron, sineseparate talaga nila yung mga parts ng mga puffer fish na toxic. Tapos dalawang way para maiiwalay nila yung toxic sa hindi. And hindi nila mapigilan na kumain pa rin ng pufferfish because it is different. Meron daw siyang distinct taste. Awan ko kung may nakakain na dito ng pufferfish. Hindi ko rin alam, hindi pa ako nakakain. Pero baka may nakapunta na dito ng Japan. Mas iba daw yung lasa na. So, tetrodotoxin is that poison. Okay? Segwayin ko lang yan. Kasi ang galing parang gusto ko talaga makakain ng pufferfish talaga. Dati talaga kasi, hindi ako believer ng Japanese food. Pero nung nakatikim ako ng sashimi sa rules, sarap. Sobra, parang gusto ko na lagi kumain ng sashimi. Pero pag hindi ko makain ng sashimi, yung ayaw ng hilaw, try yung ang sarap talaga, promise talaga. Pag nagkaroon kayo ng chance, try nyo. Ang sarap kumain ng hilaw pala. Kasi ako, doon lang ako sa luto, tempura, mga ganon. Pero nung natikman ko yung sashimi, sabi ko, ayoko talaga, try ko. Pero nung na-realize ko, ang sarap para ako yung alam niyo sa, nakapanood ko ba kayo ng Cooking Master Boy, tsaka Yakin Natin Japan. Nakanood pa kayo doon. Hindi nyo alam yun. Sayang, wala akong. Kasi yung yung Yakin Natin Japan, gumagawa siya ng tinapay, tapos para siyang nagiging extra sumasayaw yung diwa mo pagka natikman mo, sayo mo, parang gano'n. May anime na gano'n dati. Sorry, hindi tayo para sa mga pinapanood dati. Yung Yakin Natin Japan yun. Nakukulog na ako, sorry. Pero yun nga, sarap siya. Tetrodotoxin. Parang hindi naman sayang yung pinento ko. Tetrodotoxin. So this is the yun yung tinatanggal sa pufferfish. And it is deadly according to the Japanese it can kill you up 1 hour after you ingested that toxin. That is the most poisonous fish in the world. Yun ang sabi niya. So for the phytotoxins, we have these drugs. So ang alam ko sinama ko sa exam ng before is ito yata, kasama. No? Siyempre, hindi nila lalabas wala yan. Okay. But this, kung yun nga, baka lang ulit may lumabas din dito sa board exam nyo. So, sabi niyo, Lord, thank you. Naging instructor ko si Doc Vico. No? Yeah. So, it is, parang summary label lang. I-familiarize nyo lang kahit hindi nyo na basahin. Pero, for the purpose ng exam ko, baka kailangan yung i-memorize. Ano yun? Ibigay ko na. Yun ang ang sabi ko, di ba? Baka for the purpose ng exam ko, baka gusto nyo basahin. Ay, maganda. 10 items lang yung buong farm. 10 items lang yung ano, tapos biglang 10 yung. Eh, di sana lang pa-enumeration na lang ako. Okay? So, yung table dyan is just a supplement, no? For that, nakita ko lang kasi yung summary table na yan. So, you can just check it, no? So, that's the end of our lecture for today.